All right, we'll get started. Again, welcome to the California Health Interview Survey, CHIS, for the CHIS Data User Training webinar. My name is Peggy Toy, and I'm the Director of Health Data. We're a public service program of the UCLA Center for Health Policy Research, and I'll be one of your trainers today. On behalf of the center, I want to thank the California Endowment for its support of today's training. The California Health Interview Survey is the largest state survey for population-based health data for policy analysis, development, and advocacy, for service and program planning, and for research. Data from the are widely available, and we're going to show you free online tools you can use to access CHIS data that may be of interest to you. These include AskCHIS, a data query system to obtain statistics on a wide range of health topics. We'll show you AskCHIS Neighborhood Edition, a GIS search tool, and the COVID-19 dashboard. These are tools that track COVID-19 and related risk factors. Today's training provides an overview, a basic overview of each CHIS data tool and how to use them to get CHIS data, how to read the estimates, and how to interpret the data. More than 20,000 Californians, including adults, teenagers with parent permission, and children by parent proxy, are interviewed each year on a wide range of health topics. Some are shown here: health status, access to health care, insurance, and so on. CHIS is conducted in multiple languages, including English, Spanish, Chinese, both Cantonese and Mandarin dialects, Korean, Vietnamese, and Tagalog. Joining me in presenting today is Jacob Rosalez, the CHIS Data Dissemination Manager, and our Community Profile Data Team, Shadani Sati, Kavya Jiwadi, Yuvraj Gill from the UCLA Center for Community Learning. They'll show you how these tools that we're demonstrating today can be used to obtain data to contribute or to inform a community profile. So with that, I'm going to go to the CHIS website. So this is the center's landing page, which you can see you can access the California Health Interview Survey anywhere on our website, as well as the CHIS website. So I wanted to point this out because you can see some of the resources, information available to you, more about the survey itself, the survey design and methods, how to get data. We're going to show you that in a second, and the many publications that use CHIS data that you can reference for information that might be useful for your topic of interest. And our tutorials. We'll have a link to our on-demand learning center where you'll be able to access videos on all of the tools that we're demonstrating today and additional articles that will provide assistance for understanding the data estimates, how to interpret them, and how to apply them. So I'm going to go to AskCHIS. And as you can see on the landing page, both AskCHIS and AskCHIS Neighborhood Edition are displayed. You can see Neighborhood Edition is also available in Spanish. And both of these, if you set up an account for one, you can access the other. So I'm going to go to AskCHIS. Now, I already have an account set up. And so it's already in here because I was looking at it. So if you don't have an account already, when you click on AskCHIS, it will take you to the account setup page. It's very simple information so that you're able to access it on your own and with some little bit of information about the work that you do and your interests so that we can be responsive to our users. So this is the AskCHIS landing page, and you can see there are 5 variables that make up our query. Excuse me. So first is our geographic area, and you can see that it defaults to the state. So the estimates are statewide, but you can select smaller geographic areas. And you can see that the geographic areas, there are 58 counties in California and they're organized by regions, Northern region, Bay Area, and so on. Los Angeles County, because of its population size, is a region, and then all the other Southern California counties. For Los Angeles, you're able to access smaller geographic areas. These are service planning areas that have been established by the Los Angeles County Department of Public Health, and a similar segment of the San Diego area, county, is segmented by health regions, also by San Diego County Health Department. But I'm going to select Los Angeles County. So I need to go and select from the listing of regions and click next. And we can see Los Angeles County is displayed in the geographic area field. The next is the topic of interest. And we can see our screen displays the list of categories. These are topic categories that are quite broad, from health status, cancer, health behaviors, access and utilization, insurance, and so on. Now, I'm interested in health disparities. So one of the things that I want to know is, what about access and utilization? So I'm going to select that topic. So we can see a number of subtopics are displayed under access and utilization. Usual source of care, doctor visits, emergency room use, hospital, delay of care, and so on. One of the things I'm interested in is usual source of care. So we can see when we select that category, we can see a number of topics are displayed. Has a usual place to go, type of usual source of care, receive care from a health provider through video or telephone, and so on. I'm going to select have a usual place to go when sick or need health advice. This is useful information to determine if this is a question or a topic I want to get an estimate or statistics on. So we can see that this most recent year, 2019, is displayed. And we can see all the years that this question was asked from the very beginning of CHIS. So if you want to do trend analysis, you can do that with this question. We can see the age groups that are involved, children, teen, and adults. And we can see what will be displayed if I select this topic. Has a usual source of care or does not. But it's also interesting to read how was this variable constructed? And we can see that it was made up from multiple sources or questions about having a usual source of care. And so those who report that they go to a doctor, my doctor, or they identify a specific healthcare provider are considered to have a usual source of care. So it's helpful to know how that question or that variable is constructed. It also identifies some publications you may want to look at that use this data and provides further analysis. So I'm going to select have a usual place to go when sick or in need of health advice. So it shows all of my variables. I just want to check geographic area, my topic. We're going to come to compare topics later and talk about limit population and then the years. We only have the most current years is what we're interested in. So I'm going to get data. And so we can see that having a usual source of care for Los Angeles County, the percentage of those reporting that they have a usual source of care from the California Health Interview Survey for Los Angeles County is 83.4%. So when you hover your pointer over that estimate, excuse me, it tells you how to read it. So 83.4% for Los Angeles County. And then that second line is a range. It's a percentage range from 82% to 84.9%. This is the confidence interval. And this range, the narrower the range, the more confident they are that this represents a true value for the population for Los Angeles County. Right anywhere that you are using any of the functions on CHIS, you'll find an explanation for how to read the data or some of the other pointers or guidance you can get for using the data. So it tells us here, if we look at the lower left-hand screen, it talks about confidence intervals. What is it? So In this explanation, it talks about the range is the confidence interval, as we just mentioned, and that the table is an estimate that's very close to the actual value. It's based on a statistical formula used by CHIS to come up with that estimate. Now, so what you need to know is this is a 95% confidence interval. So you can assume with 95% confidence that the real value is between the lower and upper range. The narrower the range, the more confident you can be in reporting estimate. If you see an unstable estimate as a reflection of a lower confidence interval, that means that it's recommended not to use that data. And there are solutions for how to stabilize the data that we'll see shortly. So this is useful, but it doesn't get at the question of really what is the distribution of access to care among the population groups in Los Angeles County. So to get at that question, one of the things that we want to do is compare the demographic groups in Los Angeles County. So that takes me to compare topics. So under compare topics, it takes me back to the topic screen, and we can see all of the categories. You can also look at what are some common comparisons, and you can see currently insured is one common one, gender is another. I'm interested in the race ethnicity groups in Los Angeles County. So I want to select demographic. Excuse me. So as we can see, there are a number of characteristics for the population. So I'm going to select race ethnicity, and on the screen displays a number of sources for race ethnicity data. One is from the Office of Management and Budget for California Department of Finance. It's most commonly used. Rates from the census, and race categories as designed by the UCLA Center for Health Policy Research that was established in 2007. It's currently used. So if we look at OMB, we'll see the differences how race is categorized by these measures. So we can look at this has been used for every year of the survey, all of our age groups, and then we can see that we have Latino as part of it, but every other population group is identified as their population group that is also non-Latino. And it's helpful to see how this variable is constructed. From the Office of Management and Budget, Latino is considered to be a race category for this variable. So any individual who reported that they were Latino or Hispanic origin were assigned the Latino category. So looking at some of the other, so if we look at the census, we can see that for the census, there is no Latino category, and that's not going to be helpful for Los Angeles County. Again, there's an explanation of how that variable was constructed. And then for UCLA Center for Health Policy Research, they have all racial categories listed. And it tells us that for this variable, it takes into account the group the respondent most identifies with. If the respondent identified with more than one, they would fall within that two or more race category. So we can see that it's the self-perception of the respondent that is where they will fall in a CHIS using that measure. So we're going to select Office of Management and Budget or the Department of Finance, and we can see all of our variables here. We'll get our data. And so this pop-up message tells us that these variables produce an unstable estimate, and that's seen by a red asterisk next to the estimate. It also provides us with some solutions. Often you'll see an unstable estimate because that population's numbers within our sample size, remember the state of California, around average 20,000 respondents every cycle of the survey. So they are taking a portion of that population and may not be represented in the sample size to make a stable estimate. And so here's some solutions to increase it. You can increase the number of years that's included in the estimate. You can also go to a larger geographic area as well to increase the sample size for a given population. You can also collapse the topics. So let's apply some of these solutions. So we can see here where these estimates are either unstable or non-existent. So we weren't able to produce an estimate for American Indian Alaska Native, nor for, we have an unstable estimate rather for Native Hawaiian, Pacific Islander, and also for two or more races. So one solution that was offered is to increase the number of years included. So when we click on the edit button, the years come up and we can see all of the years that this question was asked. I'm going to select the most recent 5 years. So I don't want to compare the years. I want to pull them all together. So I'm going to select pull and get our data. Let's see if that solved our estimate issue. So we can see that we still have not fully stabilized our estimates. Let's see what we got. We can see that we do have estimates for those populations where there were empty cells, but we still have that red asterisk for American Indian Alaska Native, also for Native Pacific Islanders. It has stable two or more races. So the other solution was to collapse the topic. Oops, I'm sorry. We have to collapse the compare topic, which are the race ethnicity populations. So as we can see, we have all of our populations listed here. So we're going to collapse American Indian Alaska Native with Native Hawaiians, and we're going to include two or more races within that category. So now we can see the major population groups as well as our other population groups. And now we've stabilized all of our estimates, and we can see that we now have stable estimates for each population group. So among Latinos, 80.5% reported that they had a usual source of care. Whites, a little higher, 90%, African Americans, 90%, and so on. But I'm going to get at this question of does not have a usual source of care. So this is a significant piece of data, but it doesn't quite get at how these populations are represented among those who answered that question, that they do not have a usual source of care. So one of the things that we can do is to transpose the layout. That is, we're going to change the denominator to look at the distribution of the population in answering that question. So we can see in this display of the data that we have a listing of each population group and how they answer, what proportion of that population was represented in those answering the question. It gives us a different view of where those populations that do not have a usual source of care. So as we look at that column, we can see that the top estimate, rather, 62.5%, make up Latinos or Latinx. So that percentage means that more than 50%, 60.5% of those who said they do not have usual source of care are Latino. And it's also displayed for all of our other population categories. So one of the things that helps us to have a better picture is maybe looking at how the data is displayed. I like to take a look at a chart. But I think with the chart, it really brings a visualization to the data to show the differences among the population. So we can see this distribution of the population among those reporting they have a usual source of care. And when we look at it from this point of view, we can see that 46%, even though it's a high percentage of Latinx represented in answering the question, it's, as we look at, does not have a usual source of care, more revealing in terms of the access to care and who has access to care or is accessing care. And we want to look at some of the other factors that may influence this estimate or why this population is a high percentage of those saying they do not have a usual source of care. And we see that blue line where the Latinx population extends far beyond 60%. So it's significant in looking at resources and other decisions about access to care. Again, this is for Los Angeles County. Other areas may be different, and other population groups may reflect a different mix. We're not limiting the population because it's already limited by race ethnicity. And so the other thing we might want to look at is a trend line. Is it just for 2019, or do we want to see how it displays over time? So it's asking us, which would you like to the trend to compare? usual source of care or does not have a usual source of care. So I want to see over time, has there been a change in the Latinx access to healthcare or having a usual source of care? So when we select the trend line, it doesn't show because remember, we were comparing years. We were pooling years, I'm sorry. So by selecting compare, we're able to see a trend line. Again, it produces unstable estimates because it takes us back to our chart and because it's comparing years on the chart. But we want to show a trend line. So again, we select the Trends tab. It's asking me, do I want to show usual source of care or does not have a usual source of care? I want to see does not have a usual source of care. And there we see our trend line. And we can see over the last 5 years that the Latinx population has consistently been a larger percentage of those who report they do not have a usual source of care when compared to other race ethnic groups in our sample. So these are some useful tools that help you to analyze your data, to take another look at data to better inform some decisions about how the data can shed light on some decision about the population or service or the work that you're doing. So with that, I do want to point out a couple of other things. That links to our tutorial and our on-demand learning center will be in the chat box. And we have an evaluation survey, which we'd like you to take at the end of today's webinar. I do want to say that you can export this into Excel for further analysis, and you can also save any of your queries in your own library to return. And you can see I have several here around this topic. And so with that, I'm going to turn it over to Jacob Rosalez, who's going to show Neighborhood Edition and also the COVID-19 dashboard.
Thank you, Peggy. All right, let me just get my video rolling and we're ready to roll. Okay, so we're going to discuss AskCHIS Neighborhood Edition. To get to it, and this is just taking you back to the center's main page, I just want to reiterate, we have this green toolbar here. And if you click on AskCHIS, it's going to take you up to the AskCHIS. So you can either go AskCHIS, AskCHIS Neighborhood Edition. Logging in is the same AskCHIS and AskCHIS Neighborhood Edition, same login, same username, same password to get into both. So we're going to go into AskCHIS Neighborhood Edition. This is the landing page for AskCHIS Neighborhood Edition. Just for brevity and stuff, I usually I call it AskCHIS NE. The one thing I want to point out is the differences between AskCHIS and AskCHIS NE. And AskCHIS, you are getting direct estimates from the survey data. And AskCHIS Neighborhood Edition, these are modeled small area estimates. They're using multiple years of data to model the estimates for geographies that range from census tracts, zip codes, city, county, legislative districts, those being congressional districts, California State Assembly District, California State Senate District, and also the entire state. So we have a much more robust selection of geographies in AskCHIS NE, but the estimates are they're modeled small area estimates. They are not direct survey estimates. AskCHIS provides direct survey estimates. So that's one thing I really wanted to bring up. We do have a help section here. If you select this, it's going to give you more specifics on kind of how-tos, general information on the different indicators that we provide, data limitations, methodology brief on how we develop the modeled estimates, information on GIS and FAQs. So just this past month in February, we were able to update AskCHIS NE with 2018 data. So this is as current as we possibly can get right now. After the CHIS 2020 data release, we will be updating with the 2020 estimates. We do every 2 years. For 2018, we included some new health indicators, those being, we added 3 new oral health indicators: teeth in fair poor condition for adults 18 and older, uninsured, no dental insurance, 18 and older, and visited the dentist for children 2 to 11 years old. We also added a new tobacco indicator, e-cigarette user. These are new indicators for 2018. You see, we have environmental factors. Right now we have Cal EnviroScreen 2.0. We are working on updating with Cal EnviroScreen 3.0. That'll be in the future. Our sociodemographic data is coming from the American Community Survey. That's a product of the US Census Bureau. We've also included these vulnerability indices. These indices are only at the census tract level. You can't get, you won't be able to get indice scores for any of these at anything besides census tract. They're the Area Deprivation Index, the Healthy Places Index, the Social Vulnerability Index, and this pre-existing health vulnerability index that's derived from AskCHIS Neighborhood Edition data that was created in conjunction with the California Health Policy Center for Health Policy Research and the California Neighborhood Knowledge Center. Okay, let's get into this. I'm yapping your heads off about all this different stuff and new stuff, but let's really poke in here and see what's underneath the engine. So I want to look at uninsured. I'm going to go the most recent 2018 uninsured for adults. Select this. And you see right away in my data table, I get an estimate for the state of California, and now I have to add some locations. I'm kind of curious about looking at Boyle Heights. I've been really interested about like the Boyle Heights area. So that's what I want to look at. So I'm going to add some locations here. I can search. So what I want to do is I kind of want to look at like Boyle Heights and compare it to, say, other areas in Los Angeles. So for now, I'll just say Los Angeles County and the city of LA. And then I'll also do one of the zip codes in Boyle Heights, 9003. Oops. Add that. Create my table. And you see, I have my data table, my map gets plotted. In my data table for those that are currently insured, we get estimates for the state of California, Los Angeles County, the city of LA, and the 90033 zip code. We also see we have a graph here that allows you to kind of see the different estimates, and we have essentially a trend line for what the state, it kind of gives you an idea of what the state is at. The map gets plotted with the zip codes, and you see here it gets zoomed into our zip code. My zip code of interest is bordered in orange. Alongside this map, I have other tools. I have this demographics widget. So as I go around and hover on the different geographies for the zip codes, I can get information on federal poverty level, race and ethnicity, and the population age breakdown by male and female. So you see here as I go, it's dynamic, and you see the graphs are changing. We also have a histogram down below. If I want to filter out and only focus on those zip codes that have much higher levels of uninsured, you see it starts filtering those out. I can zoom in and zoom out with these menu keys, or I can use my scroll bar. If I want to see the entire state of California, I select California, and it zooms out to more of California. I can navigate to the different geographies if I want to look at Los Angeles County. In the data table, I hover over the cell, you see how it's highlighted, I click on it, and it will load counties, and it will allow me to investigate everything at the county level, likewise for cities. But now I want to go a little further, and I'm curious about what's going on. What does it look like for the legislative district? I go back into locations. Sorry, and I've got this. Give me 1 second here. Go back into locations. My location pop-up comes. I say, find a legislative district. I've already got the address for Roosevelt High School. That's something I found in Google real quick. If I enter in this address, that's going to show me the different legislative districts at this address. So I have my Assembly District 53 information, tells me who the representative is for each one of these different ones. I'm going to add Assembly District 53. Create my table. You see now I have Assembly District 53 thrown into my map, thrown into my graph. I can look around further. But as you notice, a lot of these geographies are they're kind of large. They're not really kind of getting at a smaller neighborhood or community level. So something that we've been, since the 2016 data release, we have included census tracts. Census tracts are usually much smaller, especially when you're talking about large urban areas such as Los Angeles. You can really get down and pinpoint smaller neighborhood area and get smaller neighborhood estimates. So let's investigate census tracts instead. We'll go back to the location. I'm going to remove the zip code. Here I will select census tracts. This will load a map and it'll allow you to search for census tracts. The map loads. The default is set for Los Angeles. You can, if you know your area, you can zoom in, zoom out, find your census tract, or we have an address lookup. That's usually the best one. Unless, for me, I find it really simple. If I want to try to find Santa Monica census tracts that are close to the ocean, it's very easy. I just drag towards the ocean, go west, and then find those tracts. But a lot of times when you're inland and maybe you can't orient yourself too well, you can use this address lookup. Search for an address. It highlights the tract that the address is in. It also puts a pin drop on it. So I'm just going to add this selected tract to my map. Create my table. And now you see that I have estimates for currently uninsured by the state of California, Los Angeles County, Assembly District 53, Los Angeles, and the tract, Los Angeles County Census Tract 2043. Now with this, we just viewed one single census tract, but we can also do a combination. We can combine or pool geographies together to essentially create a custom geography. Go back to location. If you want to combine, say, counties together, maybe you wanted to do San Diego County and Orange County. Simply search and then have it add to the current selection. It won't add because I already have 5 in here. The limit is 5 geographies. It will not allow you to present any more than 5 geographies in your data table. So for this, you can combine counties, you can combine this. So with combining on this combine locations feature, you can only combine counties. So so if I'm looking at Orange County, San Diego County, I can match those together because they're both the same geographic type. I could combine cities together. I could combine zip codes together. I could combine legislative districts together. That's fine. But you cannot do county and city. You can't mix and match like that. It only allows the same geography type. To combine census tracts, you have to go back to your census tract selection tool. The map will load. And here, what I want to do is I want to create a much larger neighborhood for Boyle Heights. It's not going to be the entire Boyle Heights neighborhood, but I'm just curious about some of the tracts and how they look combined as one larger neighborhood. So what I did was I went back to that same Boyle Heights tract, and I can now select other tracts. I also have this lasso tool. Sometimes this is really useful when you're creating much larger areas, so you don't have to go click and click and click. You see, and if you want to remove one of them, you just unclick it. It's a click, it toggles off and on. You select combine selected tracts. And now I will create the table. And you see I have my custom geography, my custom neighborhood, whatever I want to call it. It's the default is it just calls it census tract group 1. And now it computes a new estimate, a new confidence interval, and a new universe size. So that was essentially how you can go in and out of selecting your locations, selecting your census tracts, combining your locations. Other features that we have is we have export features. So you can export your map. See, I download it as a PNG file. And now I have a map of this specific indicator with the graphs and the information. It's great for PowerPoints. You can also export your data table. It's going to come in a CSV file. And while there is a limit of 5 geographies in your data table, you can have as many indicators as you want in here. Please note, for census tracts, it's only available years 2016 and beyond. So we have 2012 and 2014 data. However, we do not have census tract data available in your data table. If you have a census tract selected with 2018 or 2016 data, and you also have 2014 in your data table, where that census tract is, it'll say no data, data unavailable for census tracts. Okay, that's AskCHIS. Now that's AskCHIS Neighborhood Edition. Now I'm going to move on and segue over to our COVID-19 dashboards. So again, the main page for the center, we have this health profiles. Down here are COVID-19 dashboards. We have a menu on this page of the different COVID-19 dashboards. We have our 2020 CHIS COVID-19 preliminary monthly estimates dashboard, our COVID-19 rates and risk factors by California County dashboard, our COVID-19 rates and risk factors by California County data table, and the NHPI COVID-19 data policy lab dashboard. I'm going to go over the 2020 CHIS COVID-19 preliminary monthly estimates dashboard with you all. So this dashboard provides preliminary monthly estimates from the 2020 California Health Interview Survey. When COVID-19 hit, we decided we're going to include COVID-19 specific questions in the CHIS survey. They covered a myriad of topics: treatment, whether or not they were tested, whether or not responses were tested, acceptance and views towards the vaccine, personal impacts of the pandemic, financial impacts at home, work, as well as some reactions to race type variables, a conflict at home during the stay-at-home orders, and then also issues with regards to not having health insurance. You see in this dashboard, we have it broken down by these different areas. On our first COVID-19 treatment dashboard, It covers all the different treatment variables that we had questions, if they had or thought they had COVID-19, if a health professional was contacted about their COVID-19 concerns, if there was a suspicion of COVID-19 from a health professional, if a respondent was ever tested for COVID-19, if they ever received a positive test result for COVID-19, and if they would get a COVID-19 vaccine if available. Now you see here on this dashboard, we allow for filtering by different months, as well as filtering a graph by different demographic and health indicator variables: age, sex, race, ethnicity, California region, educational attainment, etc. We also provide sub-state estimates. Some of these estimates are at individual counties, those larger counties such as San Diego County, Orange County, Los Angeles County, San Francisco County. And then some of the counties are grouped together, like these Northern California counties and some of the counties in the Inland Empire and Central California. You can change the estimate here, right here. This estimate is COVID-19 treatment if they would get the COVID-19 vaccine if available, and it's filtering by the geography total. You do it by these different indicators here. For these sub-state estimates, they were pooled. It was either pooled data from May and August or May to June. And then we also have these Asian and Pacific Islander specific COVID-19 questions that were asked. These questions were asked beginning in May. This data is pooled from July to September and represents a subset of questions from 2020 CHIS that were asked to Asian and Native Pacific Islander respondents. Those being if they directly experienced a hate incident due to COVID-19 in the past 12 months, the type of hate incident, witnessed another Asian or Pacific Islander person being treated unfairly due to their race, ethnicity, have had difficulty performing work due to poor internet or lack of usable computer, main source of updated news information about COVID-19, types of bills they had trouble paying during the COVID-19 pandemic, and views on government and education system during the pandemic. Filtering is allowed at these different demographics: sex, age, ethnic subgroups, California region, citizenship status, etc. You'll notice throughout this dashboard, we have a notes about dashboard section. This provides you more information on the estimates, as well as information on if the data was unstable, suppressed because of sample size, or not calculated for a specific data point. It also provides information on the sample size for each month of this survey, as well as we have a methodology section. So that's all I have for the COVID-19 dashboards. I highly recommend going to our COVID-19 dashboards pages and explore. These other ones have more information about COVID-19 with regards to the rates, the numbers and rates of COVID-19 COVID-19 cases, as well as COVID-19 deaths by California county. This dashboard here also has specifics on race and ethnicity by the counties that provide that through their public health department. This NHPI COVID-19 data policy lab dashboard provides more detailed information on COVID-19 in the United States at the state level, with death rates for Native Pacific Islanders, Native Hawaiian Pacific Islanders, as well as other race ethnicity in the United States. With that, I'm going to hand it over to our health profiles team, and Chodney will be taking over. Thank you for your time. I appreciate it.
Okay. All right. So who's at risk for COVID-19 is a question that has been constantly brought up as the pandemic continues to exacerbate lifestyle, economic stability, and healthcare access in minority communities. Recently, there's been a focus on COVID-19 disparities afflicting African American communities. So today, we will hone into the prior question and whether health-related risk factors disproportionately affect African American individuals during the pandemic by navigating through the COVID-19 dashboard. From history of Black community marginalization due to systemic racism to recent movements such as Black Lives Matter, amplifying the suppressed voices of Black individual cries, they have continued to fight for their rights politically, socially, and most importantly, medically. But African Americans continue to face the ramifications of systemic racism in that they don't have access to many healthcare resources and may experience distrust upon receiving support from healthcare institutions. Predating back to the Tuskegee syphilis experiment, the higher percentages of African American distrust for medical treatments today could be related to the researchers and the government under provision of promised treatments. Connecting to the COVID-19 pandemic, literature outlines that African Americans are hesitant to receive the COVID-19 vaccine due to medical mistrust of providers, the healthcare system, as well as treatments. Let's explore why this is the case by looking at this first study. This 2020 study sampled 101 individuals who were African American living with HIV. By looking at this extremely marginalized group, we can see how different sources and availability of information may contribute to their distrust toward the healthcare system. Though the data in the study is limited, these patterns can be seen in a spectrum of literature. So researchers in the study asked respondents to endorse statements that they resonated with. In Los Angeles, California, 97% reported endorsing any mistrust belief. 62% reported distrust of the government and the information withheld. Now, what's interesting about this percentage is that more than half the respondents expressed their level of government-level distrust. 54% reported agreement with vaccine hesitancy beliefs. 51% reported their distrust in the COVID-19 vaccine safety and treatment acceptance beliefs. And lastly, 50% reported distrust for COVID-19 treatment safety. So in the subset of African Americans with HIV, a significant portion of the study participants expressed distrust in the government's information about COVID-19 and accepting the COVID-19 vaccine as safe. So now let's shift to this table here. This data includes informational source type and assigns a trust score, 1 being lower trust and 5 signifying higher trust. When respondents were asked about trust in service providers and health professionals, this category was assigned with a score of 4.3. When respondents were asked about trusting briefings from the federal government, including the President of the United States, the category earned a trust score of 2, which means lower trust. Overall, this data shows that respondents had more trust in local health and government officials, but less trust in the government. So now that we have a baseline knowledge for who's at risk for COVID-19 by framing the construct of distrust and its effect on African American populations, let's investigate the African American vaccine acceptance on the state level with using the COVID-19 dashboard. Okay. Okay, so this is the COVID-19 dashboard that you see. And as you can see, there are a lot of tabs on the top. But for the purposes today, we will be looking at the COVID-19 treatment tab as well as the substate estimate tabs. So let's start with the COVID-19 treatment tabs. As you can see, as I scroll down, there are several topics that were asked to all the adults within California. And as I scroll down the dashboard, I can see a topic that interests me that relates medical mistrust to the likelihood of one getting the COVID-19 vaccine. And that topic is would get the COVID-19 vaccine if available. So it's preset to August, which is the recent pooling month for the data, and I'm not going to change that. But I will be going to the filter graphs entry, and I will be filtering it by race and ethnicity so that we can focus on the African American population state sample and their likelihood of getting the vaccine. Okay, let me try this one more time. My apologies, it's taking a little while to load, but we will get back. Here it is. Okay, perfect. So according to this data, I'm going to first direct your attention to the yes category of this data set here. And so according to this data, in the state of California, 64.9% of all African American individuals sampled within the state would get the COVID-19 vaccine if available, in comparison to the 77.2% of the Latinx, 82.4% of the white, and 80.1% of the Asian populations. So there's around a 10 percentage point difference between the African Americans and the Latinx population. And there's around a 20 percentage point difference between the African American populations and the white populations in wanting to get the COVID-19 vaccine if available. So we can see that there's a difference between the African American vaccine acceptance compared to all the other racial groups. So does increased African American distrust lead to one's vulnerability of getting COVID-19? Well, underlying health risk factors, including cardiovascular disease, asthma, and diabetes, can disproportionately affect African Americans during this pandemic. So with medical mistrust, they could be less likely to get the COVID-19 vaccine, making them more susceptible to the disease due to underlying health conditions. So this answers the second question that we talked about in the beginning. So now that we have seen the statistics of state-sampled African American populations and the other populations, now let's see if we can hone in on whether we can draw similarities on county level data. And so with that, I'm going to be moving over to the Substate Estimates tab to see if the African American populations within LA County and Alameda counties want to get the COVID-19 vaccine if available. Okay, perfect. So the May-August pool is already preset, so I'm not going to change that. The topic that we're going to be investigating is COVID-19 treatment, so I'll be keeping that the same as well. And the question that I would like to answer with the substate estimates is, would get COVID-19 vaccine if available? And the first thing I'm going to do is I'm going to actually keep the filtering map by demographic and health indicator to be geographic total, so that we can see the percentage of the total inhabitants within each county who want to get the COVID-19 vaccine if available. So in LA County, 78.6% of the total inhabitants want to get the COVID-19 vaccine if available, in comparison to the 86% of the total inhabitants in Alameda County. Now to note, Alameda County has a smaller percentage of white individuals, and their poverty is relatively higher. So the fact that 86% of the Alameda County populations want to get the vaccine could be reflective of the other racial groups constituting that population. LA County has a dominant percentage of white individuals living there and less people living under the poverty line in comparison to Alameda County. So this data shows that population makeup and geographic locations influences individuals' likelihood of getting the vaccine if available. Now I will be filtering the map by race and ethnicity to be Black, to see the proportion of African Americans within both counties who would want to get the COVID-19 vaccine if available. So in LA County, I see that 62.2% of the Black population would get the COVID-19 vaccine if available, in comparison to the 59% of the African American population in Alameda County. In Alameda County, the percentage of African Americans who would want to get the COVID-19 vaccine is, there's almost a 4 percentage point difference between the LA County inhabitants who are African American and the Alameda County inhabitants who are African American. So we see that African American populations in Alameda County is less likely to get the vaccine in comparison to LA County. Now, I would like to compare the percentages of African Americans who would want to get the COVID-19 vaccine if available in both counties to the percentages of white individuals in both counties. So I'm going to be filtering this to race and ethnicity to be white. And I chose the white populations as a comparison due to the inequities between both of these groups. Okay, in LA County, 84.9% of white individuals would want to get the COVID-19 vaccine if available, in contrast to the 94.6% of the white population in Alameda counties. In both counties, there is a lower percentage of African Americans who would want to get the COVID-19 vaccine if available when compared to the white populations. This could be linked to medical distrust of the COVID-19 vaccine. Through data comparison between African American and white populations, as well as literature, we have not only seen that medical mistrust deters Black individuals from accepting the vaccine, but its addition to underlying health risk factors further marginalizes African American populations, making them more susceptible to contract COVID-19. Now that we've explored the COVID-19 dashboard and the two features, and the many thorough features, I will hand it off to you, Raj, who will be using AskCHIS to hone in on risk factor data from African American communities in LA County.
Thank you, Chandni. Now I'll be using AskCHIS to look into a few more factors that may be disproportionately affecting the African American population in Los Angeles. We'll begin by choosing our geographic area in AskCHIS as Los Angeles County. The topic we first want to explore is going to be household incomes, and we'll be comparing this and the upcoming topics to race. As for limit population, we'll not be excluding any one group of people, but instead pool together races for which the sample size may be too small for us to get statistically stable data. For many of the topics we'll cover, we also pool together many years of data to confirm we'll receive statistically stable data in each category. All right, we'll start by looking at the annual household income of African Americans compared to other races in Los Angeles County. As we look at the data table, we can see that there's a higher number of African American households that have an annual household income between $5,000 to $20,000 at 27.9%, whereas 9.8% of the white non-Latino population falls under the exact same bracket. When at the opposite spectrum, only 28.6% of the African American population have an annual household income of at least $80,000, while 52.3% of white non-Latinos fall into this higher income bracket. A trend we see in this data table is as we move towards higher household incomes, the percentage of African Americans that occupy these brackets begins to decrease, unlike the white population, where the exact opposite happens. This disparity in wealth can potentially play a role in the types of jobs available to African Americans, as well as their current working status. Next, we'll look at the current employment status, as well as the main kind of occupation that is occupied by the African American population of Los Angeles, two factors which both can heighten the exposure to COVID-19. The African American population has the smallest percentage of full-time workers at 44.7% when compared to the other major racial groups in Los Angeles, such as white and Latino. In addition, the African American population also makes up the largest percentage of unemployed workers at 44.6% between the major ethnic groups of Los Angeles. With less full-time employment, they're more likely to be subjugated to minimum wage jobs that hold a higher risk of exposure to COVID-19. Due to the nature of these jobs, it may be more difficult for the working African American to also work remotely from home. Now we can look at the main kind of occupation that each group is more involved in. On the left, I've already collapsed the topics into occupations that can be done remotely in the first category, such as education, management, and computer engineering, as well as jobs that still need to be done in person, such as transportation, installation, maintenance, and repair, as well as other similar categories, as well as other similar occupations. In the third category, we have healthcare, which is not directly related to what we're looking at in this data table, since it falls somewhere in between the other two categories. Since it falls somewhere in between the other two categories. When we look at the distribution of these occupations, we can see that jobs which are more likely to be done remotely are most occupied by white non-Latinos at 63.8%, and by other racial groups that are not African American or Latino. whereas jobs that are more likely to be done in person during the pandemic are largely occupied by either the African American population at 49.4% or the Latino population at 63.4%. Another factor we'll be looking at is underlying health conditions of the African American population of Los Angeles County. Since underlying health conditions such as diabetes and asthma can make the population of people more susceptible to not only getting COVID, but also to its effects. The first health factor we'll look at is diabetes. When we look at the section diagnosed with diabetes, 16.1% of the African American population is currently diagnosed with diabetes, whereas 8.1% of the white and 12.4% of the Latino populations are diagnosed with diabetes in Los Angeles County. The other health factor we'll look at is asthma. Similarly to diabetes, the African American population has the largest percentage of individuals diagnosed with asthma at 19.8%, a larger estimate when compared to any other racial group. Underlying health conditions that are already present in the African American population of Los Angeles County can play a part in making this population more vulnerable during a global pandemic. Now, we'll be looking at factors surrounding the access to healthcare for African American population in Los Angeles County. First, we'll look at the type of current health insurance coverage that is available for them. When we look at this table, we can see that roughly 90% of the African American population has some form of Medicare or employment-based insurance. While there is coverage in the African American population, these forms of public health insurance may be limited in their access to healthcare, specialties, as well as other specific health resources. This can be true when we look at the type of usual care provided to the African American population. When we look at this table, we can see that 23.6%, or roughly 1/4 of the African American population, receives care in community clinics or community hospitals. These forms of care may be lacking in specific resources when compared to places such as Kaiser. Also, 16.4% of the African American population have no usual source of care, which limits their access to healthcare and what is directly available to them in their communities. Finally, we'll be looking at the vaccination frequency for the flu in the past 12 months. When we look at who has had a flu vaccination in the past 12 months, 35.2% of the African American population did get a flu shot, while 64.8% did not. Looking at the frequency at which the African American population receives vaccinations may give us a window into their behavior towards receiving a possible vaccination for COVID-19. Now I'll be passing it on to Kavya, who will give you more information on how we use CHIS Neighborhood Edition to address our research question.
Thank you, Yuvraj. So I'm going to be looking at AskCHIS Neighborhood Edition, which Jacob previously went over. So the reason why AskCHIS Neighborhood Edition is so unique is that we can look at specific county, city level, and even specific neighborhood data. So the first thing that we're going to do is find our target population, which is going to be the Black population. And then we're going to go to location. So what we're going to do is we're going to go from more broad to specific. So we're going to first look at the county level, select the county, then the city, and then finally we're going to look at a specific neighborhood. So the reason why we're looking at a specific neighborhood is that a lot of allocation of resources is typically done on the neighborhood level. So that's why it's important to have this neighborhood specific data. So now we're going to create the table. And we see here that simply even just looking at the statistic of the Black population, we see it is different for the state, county, city, and finally the neighborhood level. So if we go down here, we can see that this is our selected neighborhood. And when we look at the demographics, we can see that the race and ethnicity is similar to what the level stated above at around 80%. And then we can also see that the population here is primarily still in the workforce. And then finally, over here, we can see that the population from this neighborhood is typically middle and upper middle class, as shown by a majority of the population being 400% or more over the federal poverty level. So next what we're going to do is we're going to look at something like even more specific, as Jacob mentioned, the census tracts. So the census tracts are really unique because you can just simply place an address and get even more specific data compared to just a neighborhood. So right here is an address in the neighborhood of interest, View Park, Windsor Hills. And I'm just searching it. And then we can see that if we want, we can also combine the selected tracts, but for our purposes, I'm just gonna add the selected tract individually. And since we can only have 5, I'm just gonna eliminate the neighborhood and the city level data. And next, what we're gonna do is we're gonna want a target comparison population of Windsor Hills. So I have an address from Santa Monica. I chose this population since there's a much lower percentage of Black Americans living in Santa Monica. So once we have our second tract, we can create a data table. And as we can see here, the population from like the Windsor Hills census tract has around like the same percentage of Black individuals, around 80%. And in Santa Monica, it's only 3%. So one of the main factors that we previously discussed about COVID-19 and the effect of COVID-19 is pre-existing health conditions. So what we're first going to look at is diabetes. And we can see here that the population from Windsor Hills at 16.6% has a much higher rate of diabetes than the population from Santa Monica. And also similarly, we can see in asthma, something like similar that the population from Windsor Hills has a higher rate of asthma than the population from Santa Monica. And our last kind of pre-existing health condition that we're going to look at is obesity. And we can see here that the population from Windsor Hills has a much higher rate of obesity than the population from Santa Monica. All this data can be summarized when we look at our vulnerability indexes and specifically looking at the pre-existing health vulnerability index. So the pre-existing health, all the indices kind of range from 0 to 100, and 100 meaning like a higher score, which is not a good thing. So we want the score to be as low as possible. And we can see here that the number 63 is much greater than 4, and that essentially kind of summarizes what we found from our previous data about the population from Windsor Hills having much higher rates of like asthma, diabetes, and obesity than the population from Santa Monica. This is relevant in terms of COVID because these pre-existing health complications are more likely to lead to more severe COVID complications. So what makes all this data particularly really interesting is that when we go to poverty, we see that the population in Windsor Hills actually has a lower poverty rate than the population from Santa Monica. This data, basically all this data goes to suggest that while poverty most definitely does play a factor in kind of the populations that are affected by COVID-19, there's simply more than poverty going on here, and that race is something that should be considered in terms of who's affected by COVID-19. So overall, what Chandani, Yuvraj, and I kind of found through using the different tools in AskCHIS is that the Black population is one of the minorities that are disproportionately affected by COVID-19. We found different types of evidence of this, including underlying health conditions, the labor categories they're in, the decreased access to care, and medical mistrust. Some recommendations we could offer include increased advocacy and education about the disparities that exist. We would also make the recommendation about allocating more resources toward local organizations, which the Black community is more likely to make use of. Thank you. This concludes our community profile, and I will be handing it off to Peggy.
Thank you, Kavya. I'm going to share my screen we're going to answer questions. Okay. So I'm going to open up for questions, and we have some information for how to follow up. We didn't cover everything, and I see there's quite a few questions. So I'm going to throw it to Tiffany, who has been monitoring questions, and she will select some for our panelists to answer.
Thank you, Peggy. Good afternoon, everyone. My name is Tiffany Lopes, and I'm the Director of Communications here at the center. So I'll be going through some of the questions from the audience today. Let's see. So one question is,
It sounds like Tiffany is out.
Yeah, she's frozen.
Okay.
So
I have some questions here that rung up. So from Kimberly Collier, she asks, can the charts and tables created through AskCHIS be used in manuscripts with acknowledgement of the source? Yes, please. If you definitely, if you are doing any publications, any reports using data from CHIS, whether it's the public use files, which is a different product that we have, or from AskCHIS or AskCHIS Neighborhood Edition, we encourage you to please use it in your research. It's here for that. And if you give it attribute it as CHIS and the year, highly, definitely would appreciate that immensely. Please use it for your research.
I see Tiffany's come back. I do want to answer another question that came up in regards to AskCHIS and the use of the categories by source or the method for which race ethnicity is categorized between Department of Finance, Census, and the center. We did not take their data. What we did is apply their measures or their categories. So that's what you saw displayed in the AskCHIS demonstration of the different racial categories. So Tiffany, glad you
thank
could join
you.
us.
Sorry about that. It seems like there was something going on with the closed captioning and I got kicked off as well. So did we get to the question on the OMB yet, or should I re-ask that?
Yes, I just answered that question.
Perfect. Thank you. So next question. Someone is wondering if the participants in the CHIS survey are different from the COVID-19 surveys.
I think it might be helpful, Jacob, if you can talk about the sample that's used for the COVID dashboard.
So for the COVID dashboard, those are coming directly from the 2020 CHIS. It's not a subset. It's everyone we're at. And if you see in the dashboard, we have universe descriptions. So some of them, for those questions, like if they ever had or thought they had COVID-19, that was asked to all adults. So the one thing is these were adult questions only. We weren't asking teens or children. So we started asking in the months of, I believe we began asking COVID-19. I think it was late April or early May. So each month represents kind of like the total sample of responses that we got from CHIS 2024, each one of those months. So you'll see there's information on who the question was asked to. So some of them we had skips based off of if they responded to not having any financial impacts, etc. If there were any kind of questions for the probing questions about how COVID impacted them financially or types of bills they had to pay. Those Asian Pacific Islander specific COVID-19 questions, those were funder-driven questions. So those were questions that were asked only of Asian and Pacific Islander respondents. And those were from, I believe, the months of, I think it was I think it was June through September, if I'm not mistaken.
I think great. Another question for you, Jacob. Can you name geographic areas that you create, for example, a group of census tracts?
Unfortunately, no. When you group your census tracts together, the default is the first one that you group together, it's just going to call it census tract group 1. The second one is census tract group 2, etc. For any other geography, oh, I'm sorry, I didn't have my video on. Any other geography. So if you're combining counties, it's just going to say like, if you combine like LA County and Orange County, it's just going to say Los Angeles County, comma, Orange County. There's no ability to kind of create custom naming for those custom geographies that you create.
Thank you. Someone says, I noticed for the AskCHIS data exploration, race and ethnicity was used, Black, non-Hispanic, whereas with Kavia's analysis and AskCHIS NE used race alone, just Black. Is it possible to assess based on Black, non-Hispanic in AskCHIS NE?
No, in AskCHIS NE, we currently have it set up where if you see there on the sociodemographic side, we have ethnicity, and essentially we're only looking at Hispanic or Latino or non-Hispanic white. We're not providing any more, and I think that's a discussion that I'll have with other people on our AskCHIS team to see maybe we need to expand that to focus specifically on like non-Hispanic Black, non-Hispanic Asian, et cetera, et cetera. So when you look on the AskCHIS NE and the race, it's providing you Asian only, Black only, other mixed only, white only, et cetera. So it's kind of, it's data from the census. So I think that, but again, I think that's a really good question. I think that's something up for consideration to try to expand that, the Hispanic Latino by race.
And I do want to say that in AskCHIS, you do have the option. So we use the example or the method of categorizing race from Department of Finance. It may be that we're using the Center for Health Policy Research, which looks at distinct concrete categories versus racial categories and non-Latino. So just wanted to share that because that was one of the questions that came up from our participants.
Thank you. We have about 10 minutes left and we've got one more question to get to. So if anybody else has any questions, please feel free to either drop them in the Q&A or the chat. This is a question for Jacob, and I think it's kind of a highly anticipated question, given the preliminary estimates. What is the plan for the 2020 data? When will it be available?
We are looking for an early September release. Right now, we're going through the process of really focusing on a lot of, we call it OS, so other specified responses. We're doing upcoding on that. We're really, because it's a COVID year, we're really investigating those very heavily to see, when we ask stuff about like reasons for delayed care or anything like that, like, are they highlighting COVID? And then we need to talk about, well, how do we handle this? So we're looking at an early September release for the 2020 CHIS data. And we're also, just for those people that are interested in more current data for CHIS 2021, that will be in the field within the next month. And we anticipate doing preliminary monthly estimates for the COVID questions. We do have some newer COVID questions for the CHIS 2021. So be on the lookout for email alerts regarding CHIS 2021 COVID preliminary monthly estimates.
And great point. If you haven't signed up for our listservs and you do want to receive some of these emails, if you can email us at healthpolicy@ucla.edu and we'll sign you up for our listservs. And that'll include things like any updates or announcements related to AskCHIS and AskCHIS NE, the annual data release that will be happening in September and things like that. So just a couple of other questions. Is there a data category on abled ability?
Abled ability.
Yeah, I was looking in the CHIS categories, and I think that it might be helpful to share. That would be a question you can ask directly with the CHIS team. So that was posted in the chat. I didn't see it immediately in just a quick browsing through the categories. I don't know if that's the category in Neighborhood Edition.
I'm not sure. we'll skip ahead. So somebody asked if there are any outcomes on mental health. We do have a lot of mental health options in AskCHIS and AskCHIS NE. We do also have a bunch of policy briefs and publications that we've produced, especially over the last year on mental health. So if you're interested in those, this person's an anonymous attendee, if you could email us at healthpolicy@ucla.edu, I can definitely send you some of those recent publications. And then is there anything else you want to add about the mental health question, Jacob or Peggy?
Yeah, I think, so with AskCHIS Neighborhood Edition, if you're looking at different geographies and kind of like different census tracts, we have, we have a serious psychological distress, which is constructed using the Kessler 6 series. And then we also have, I know, just looking at Neighborhood Edition, we also include family life impairment during the past year, if they needed help for mental health problems or work impairment. So we do have, a myriad of different mental health in AskCHIS Neighborhood Edition and also in AskCHIS. So I recommend going through there and going through the topics and looking at that if mental health is something of interest for you all.
Thank you. I'm going to take a moment to drop the survey in the chat. If you wouldn't mind taking out the survey to let us know how we're doing, we would really appreciate that. Another question is sexual health and violence victimization part of restricted data? If so, how long does it take the approval and whole data set?
So we do, we have, I know in the last year in AskCHIS, we have a variable with regards to having sex without consent. We do have that in AskCHIS. Yeah, we do have that in AskCHIS. But some of those other ones, that's something that would be, you'd have to do a DAC request. So either email, I would recommend with stuff kind of sensitive data, any of those questions, I'd recommend just emailing chis@ucla.edu, and we'll get that to our DAC team, and they can look over that and give you specifics on the approval process. I'm not too familiar with how long approval processes take.
Thanks. One more question. Is there a link to access the full survey in order to look through all the questions, such as a PDF?
The best thing that I do is I go to Google and I just type in CHIS survey instrument. It's usually one of the first hits. And usually what I get is I get CHIS questionnaires, and then you'll get a list of the different survey years. So like it'll say CHIS 2020 questionnaires. That's the best one because the link that we have on the center page is pretty long, but I will throw that in the chat right now.
Thank you. And that is a link to, go ahead, sorry.
I was going to say, if you go into the California Health Interview Survey webpage, you'll see the questionnaires that are posted there. So it's great, Jacob, if you can provide a link, so you can actually look at the questionnaire.
Is there a DAC equivalent for the AskCHIS NE data?
Yes. So for getting that, we have two different types. The best thing to do is email chis@ucla.edu with regards to what data you're interested in, and then we'll get back to you on data use agreements and how we go about doing that. It's kind of it's a wordy process. So I think if you're really interested in getting larger data sets of these small area estimates, just email chis@ucla.edu.
Thank you, Jacob. Is there anything else that anyone on the team wants to add before we close the session? Of course, if you do have questions for us, like Jacob said, you can email chis@ucla.edu. If you're interested in the video recording of this event, that will be posted to our YouTube page, and the URL for that is youtube.com/UCLA-CHPR. You could also email us at healthpolicy@ucla.edu. And we'll get you that link when it is available.
I just want to add that, I don't know if you can see my screen, but I just want to add that I want to thank all of our presenters today, and Dr. Ninez Ponce, who's the CHIS Principal Investigator and Director of the UCLA Center for Health Policy Research, Todd Hughes, our CHIS director, and the California Endowment that provided support for today's training. And also, thank you, Tiffany, so much for you and the comms team and helping us with today's webinar and all of the links that you've placed in the chat for all of these resources. And I especially want to point out our survey. It really helps us to get your response to today's webinar. Many of you asked about continued training. We do post updates on the on-demand learning center. There's also a link in the chat box. But most importantly, please fill out our survey before you leave. We really want to know what you thought today and any of your recommendations so that we can make the training and make some improvements and make it useful for many of our CHIS data users. And so with that, I think we're right about 2 minutes. We're amazing. We're right on time.
Awesome.
Anything else?
I think that's it. I dropped the survey in the chat for one last click if you guys are able to do that. And then we do have another session coming up for media and legislators that will be happening on April 9th. If you are interested in attending that, or you know somebody who is interested in attending, please email us. We'll be sending out emails about that in the coming weeks as well.
Thank you. So don't hesitate to write us and explore these tools on your own. There's a lot to see there. And if you have any questions, drop us an email. The CHIS team has been really responsive in answering questions. And I think that's it. So with that, we're going to adjourn our training webinar. Thank you. Have a great day, everyone.
Thank you, everyone.